Estriol is an estrogen. When you hear this word, you immediately think of a female hormone. However, women and men have exactly the same amount of estriol. Let me explain why. Estriol is also an estrogen, but please do not confuse it with the female-forming estradiol. I have made a separate video about estradiol. You can find the link in the description. Estriol is equally needed by men and women. For women, it is formed in the liver and ovary. For men, in testicles and adrenal glands. It has one single function. It moisturizes the mucous membranes of the whole body. Also the skin a bit, but primarily the mucous membranes. So the symptoms of an estriol deficiency are quite obvious. Let's start at the top. Dry eyes, dry nose, dry mouth and throat. Perhaps a dry, irritating cough because the bronchial mucosa is dried out. Down in the gut, it can cause constipation. The bladder may be irritated, repeatedly inflamed. When this bladder mucosa is not moisturized, the vaginal mucosa can lead to pain during sexual intercourse. In the joints, it can cause discomfort when the mucous membrane in the joints is too dry. There is also a lack of joint fluidity. This leads to slight pain when moving the joints. As you can see, estriol is extremely important for all mucous membranes. When I look at the doctor's reports where they have measured hormones, they never test estriol. I've never seen a report where estriol was measured. It's also called the forgotten hormone, although it is critically important. So I prescribe estriol almost daily to patients with any of the symptoms that I have listed. I have also prescribed estriol to a man with dry irritable cough. Imagine the standard doctors shaking their heads, but this cough was gone after a few weeks. When you prescribe hormones, you always have to measure them. It is very important. You can't out hormones blindly. It is essential that we hit the right levels and measure in saliva and blood. Not too high, not too low. The hormones must be used correctly, and then they are helpful and beneficial. If you need treatment with estriol, then use a bioidentical estriol ointment of 0.1%. You will need very small quantities, the size of half a pea. This is spread on the arm 3 times a day. And in a few weeks, the estriol level is back to normal, and the mucous membranes are moisturized properly again.